I'm Stephanie. I'm going to be administering medication via IV mini bag. I would do my hand hygiene and put on my gloves. I'm going to be administering vancomycin, and I'm going to put in 1 milliliter in the peripheral IV, and every 4 hours. And I'm going to check labs, and I'm going to make sure they don't have a history of allergies. And vancomycin is to help fight infection, and I will monitor the patient for adverse reactions such as anaphylaxis. I'm going to administer 50 milliliters per at a drop factor of 10 for an hour, which will come out to 8 drops per minute. I'm going to clean. I'm going to check my vancomycin bottle expiration date. Clean it. I should have the needle on this until the top on this until I really need it. Draw up 1 milliliter of air.
This is trash.
Oh, don't worry about it now.
Okay. Now I'm going to open my brand new mini bag, but if I'm not opening a new one, I will use an alcohol wipe to wipe my port.
You just called me like in a bad time. I was like playing with it.
My vancomycin and sharps
I didn't
container.
even notice that. Monica was like watching me.
I'm going to
She started laughing.
label
Like,
my bag with the patient's name, the drug, the time, the date, the initials, and I'm going to connect my tubing.
okay, guys. Thank you
Good luck.
for accompanying us.
I'm going to prime my tubing, and of course label my tubing with the date, time, and initials. Open up my clamp to make sure that I have properly primed my tubing.
That's upstairs. That's on.
Okay, once the drips come out. Alright, close up my clamp.
Did you love now?
Now I'm going to come into the patient's room. I'm going to tell them that I'm going to be administering vancomycin to help them fight infection. I'm going to check my dosage against the MAR and make sure that it's a safe dosage of the medication.
Oh, good luck, guys.
I'm going to clean my port. I'm going to check it for phlebitis and infiltration. Don't see any of that. Ask the patient again if they have any allergies. I'm going to use the ASASH method to make sure that my IV is still patent. Wipe, wipe, wipe. Now this is saline instead of vancomycin. Draw up 6 milliliters of saline. Okay, I'm going to put my needle into the sharps container. I've already cleaned my port. I'm going to open my clamp and I'm going to connect. I'm going to administer 3 milliliters using the push stop method at half a milliliter each time. Once I've administered the 3 milliliters, I'm going to close my clamp back. I've established that the IV is still patent, and I'm going to connect my tubing from my primary line to my clean port. I'm going to squeeze to make sure that it is, undo my roller clamp and undo this one to make sure that I'm getting exactly 8 drops per minute, which is the proper rate. Okay. And I would come back in 10 minutes because with vancomycin you could have an anaphylactic shock. And I would come back and make sure that the patient isn't showing any signs of allergies. I'm going to check for phlebitis and infiltration. Once my bag is completely finished, I'm going to roll up my clamps, come back, make sure I have the right patient, state my name and my credentials. I'm going to hang up my tubing, clamp my tubing, make sure that I have an alligator clamp on there, and I'm going to again use the ASASH method, clean my port with alcohol. I'm going to connect and again push stop method using clamp that, using normal saline to make sure that the port is clean. I'm going to check for infiltration, phlebitis. I'm going to document the dose, route, frequency of the medication. I'm going to document the I's and O's. I'm going to document how the patient took it. And I would only use heparin if it was a central line or a PICC line. And I think that's about it.